Hello everyone, today we will discuss about the Syncope and fans. Before we will start the lecture, I wanna say that if you need the notes then visit on my telegram channel Explain Dentistry. Of course my all notes are free. Let's begin the lecture. Okay, Syncope and fans are interchangeable used in clinical practice and they denote the same pathophysiological mechanism of the production. Following is the difference between syncope and fans. First, we know about the syncope. Syncope, generalized weakness of muscles, loss of postural tone, inability to maintain erect positions, loss of consciousness. And infant, only lack of strength and sense of impending loss of consciousness. These features can differentiate syncope and fans. Usually, patients have warning sign in the form of sense of blinding, movement of surrounding object, feeling something wrong with the body, experience moving spot before the eye, and may have blurred visions, okay, and ultimately become the confused. And nausea and vomiting occasionally occurs. The patient become pale and sweats. And when you palpate the pulse, then it is fevable. Okay, blood pressure is low and breathing may be imperceptible. Next is cause of syncope and fans. Syncope and fans that occurs due to the decreased cerebral perfusions and non-circulatory cause. Decreased cerebral perfusions, it occurs due to the inadequate vasoconstrictive mechanism like postural hypotension and vasovagal etc. Okay, hypovolemia, reductions of venous return, reductions cardiac output, arrhythmias, cerebrovascular disturbance. And non-circulatory cause occurs due to the hypoxia, prolonged bed rest, hypoglycemia, anemia, anxiety, neurosis, hyperventilations. These are causes of syncope and fans. Now we will discuss about the types of syncope. Syncope may be vasovagal syncope, postural hypotension with syncope, maturation syncope, cardiac sinus syncope, cup syncope, syncope of cerebrovascular disease. Okay. Then investigations regarding this is the measurement of serum electrolyte, glucose, and the hematocrit, blood and urine toxicological screening, and ECG, hotel monitoring, uprighting tilt table testing, and other depending upon situations. Example MRI, Doppler test we can do. Treatment, aim of treatment is avoiding fall or injury during the attack, and most of the case no required any treatment. Syncope should be treated according to cause like the internal hemorrhage, myocardial infarctions, pulmonary embolism etc. Patient position should be head is lowered between knee and all the cloth must be loosed and head is turned to one side to avoid fall of tongue back into the throat as well as to avoid aspiration during vomiting. If you like my video then subscribe my YouTube channel. Thanks for watching.